Welcome back to the Score Builders Question and Answer podcast. This podcast provides members of the Score Builders team with the opportunity to explore challenging multiple-choice examination questions with students actively preparing for the licensing examination. Ready? Let's go. A physical therapist is preparing to perform the Slump test on a patient with suspected lumbar radiculopathy. When correctly performing the Slump test, which movement should be completed first? Option 1, cervical flexion. Option 2, ankle dorsiflexion. Option 3, trunk flexion. Option 4, knee extension. The Slump test is a stepwise neurodynamic test that progressively loads the nervous system by adding tension through a specific sequence of movements. Each movement builds upon the previous one, creating a cumulative increase in neural tension from proximal to distal. Because of this sequential nature, beginning in the correct position is essential for proper test performance and valid clinical interpretation. This question is straightforward if you have a solid understanding of the Slump test procedure. Think of the Slump test like building a house. You have to lay the foundation before you can put up the walls. The test has a specific order for a reason. Ask yourself, where does the Slump test begin? The name itself is actually a clue. Let's explore each of the options. Option 1, cervical flexion. Cervical flexion is not the first movement of the Slump test. While it is an important early step used to further tension the neural tissue after the patient is already in a slouched position, performing it before trunk flexion does not allow the test to follow its intended neurodynamic loading sequence. Option 2, ankle dorsiflexion. Ankle dorsiflexion is a distal sensitizing movement that places additional tension on the neural structures from below. It is an important component of the test, but it comes much later in the sequence, after both trunk flexion and cervical flexion have already been established. Initiating the test with ankle dorsiflexion would be like trying to tension a rope from the end before anchoring it at the top. It bypasses all of the proximal neural loading that makes the Slump test clinically meaningful. Option 3, trunk flexion. The Slump test gets its name from the very first movement. The patient assumes a slouched or slumped sitting posture by relaxing into thoracic and lumbar flexion. This initial position begins to load the neural structures by increasing tension along the length of the spinal cord and nerve roots. Everything else in the test, cervical flexion, knee extension, ankle dorsiflexion, is layered on top of this foundational position. Without trunk flexion as the starting point, the test loses its neurodynamic rationale entirely. Option 4, knee extension. Knee extension is one of the most provocative components of the Slump test, as it places significant tension on the sciatic nerve and lumbosacral nerve roots distally. It is the step that most commonly reproduces a patient's familiar symptoms. However, knee extension comes after the patient has already assumed trunk flexion and cervical flexion. Performing knee extension first, without the proximal neural loading already in place, would not produce the same clinical information. It's a critical step, just not the first one. The Slump test follows a clear proximal to distal loading sequence, and trunk flexion is where it all begins. The correct answer is option 3. Let's explore the all-student data. 15% of students selected option 1, cervical flexion. 5% of students selected option 2, ankle dorsiflexion. 75% of students selected option 3, trunk flexion, the correct response. 5% of students selected option 4, knee extension. This question is a neuromuscular and nervous systems question, which represents approximately 24% of all exam items. This question is a physical therapy examination question, which represents approximately 24% of all exam items. This question is a Level 1 question, since the question requires students to possess basic foundational academic knowledge. Remediation of Level 1 questions occurs through academic review of entry-level content using textbooks, review books, Basecamp, and flashcards. Looking to review related academic content? Check out page 116 in PT Exam, the complete study guide. Thanks for joining us on the Score Builders Q&A podcast. See you next week.